We have a vaccine protecting healthcare providers from COVID-19. Infection is a top priority. Right now, there is not a lot of proven options to actually reduce a person's risk.
Medical reporter Liz Bonis takes a look at a few that are in the works.
This is a pretty standard room down here.
For weeks, nurse Megan Sizemore has been caring for patients in a COVID-19 only intensive care unit.
It was crazy, it was overwhelming, it was scary sometimes.
It is also, along with other frontline healthcare areas, one of the most high-risk places for a provider to become infected with the COVID-19 coronavirus. Dr. Blatt, an infection control provider, told me until we have a vaccine against this virus, the only way to protect these healthcare providers is through frequent testing. If they test positive, then you could give them medications such as the antiviral drug remdesivir. It can now be given to those early on who show no symptoms.
It'll be something like Tamiflu is for flu. It'll hopefully shorten the duration of disease and make it less severe.
But Dr. Blatt says something like this might also help protect healthcare providers. It provides a pod protection.
I think anything that's a physical barrier that is able to prevent the virus from spreading from one person to another could make a difference.
These pods were originally designed by PESCOVITZ of Under the Weather. People use them at sporting events to stay dry. So now the goal, of course, to adapt as the need grows with COVID-19, to use a few of these where you could actually use your arms and your hands and still be protected, perhaps, from the virus. They are now being adapted for those who do testing for COVID-19 on the front lines and being tested at Duke University and Stanford inside the operating room.
So it lays just on your body like this. This way the doctors can work from behind or on either side. It catches any kind of residue.
Next step, designing one for first responders and transportation workers, all also hoping for a special delivery wrapped up in perfect protection. I'm medical reporter Liz Bonis reporting.
So those pods individually start at about $59, but cost and designs are customized for healthcare providers. We do have details on our website. As always, that's local12.com. I never thought I would see the day where we would be running a story on those pods to protect. It's just, things have changed so much.
Well, should hairstylists be doing that? You know, like people that are in close contact. I bet we're going to hear more about this. Is going to be something.
Yeah, Governor DeWine said today the hairstylists would have masks on, and they were hoping that people coming in would have masks on. There'll be no magazines, they said, in the waiting areas because they don't want people touching things that other people have touched.
I'm wearing a mask, but then when they're washing, anyway. Okay.